invite
Adelante, César.
Sorry, Dr. Marina, are you still with us?
Yeah, I'm Sarah. I just need to settle a few things. Sorry. So, who's presenting actually? Is it Georgia or? Yeah, okay.
Tu micro, César.
Sorry, technical difficulties, but I'm here. And we're gonna present to you a continuous education proposal for contextual behavioral science in Spanish. This is a work that, even though that myself and Dr. Jorge are presenting, it's a collaborative effort of the chapter Mexico Sur the members that we've been working on during these last months. Okay. So continuous education allows professionals to further their knowledge and current advances in science. It's something that it's also required a lot in our field, that we are continuously looking for better approaches and that make our job easier, and for new techniques that could help us out in our daily work. So the efficient training on this on contextual behavioral science is also a priority in the ACBS, and there are like different approaches for this. So, for example, as a community, ACBS has renounced to a hierarchical vertical system, and it's more like a horizontal one, where it's not based on certification but on professional competencies. So in turn, what we have noticed is that the purpose then is for us to build a mutually supportive community in which we can make some reflections about these approaches, about different ways in which we can tackle different social perspectives and different clinical situations as well. So that it's more like a cooperative approach instead of just like going through a vertical system. For this, then, there are like several proposals for us to go with continuous education, with continuing education programs, which can be seminars, they can be meetings, there can be like peer-reviewed groups or practice groups, such as the Portland group. There are like different approaches for it, and a lot of different chapters have tackled this situation in different ways. So what we want to introduce to you is a continuous education program for contextual behavioral science in Spanish. This has been a collective effort in which we aim to develop conceptual, professional, and therapeutic skills for the members of the chapter and, of course, the ACBS community in general, using basically directive instruction and also like the principles of functional analytic psychotherapy. So with this, we aim to create a continuous program that we can ensure of some different things, which may be that there is training in philosophical, conceptual, technical, methodological, and value attitudinal areas for the chapter members and, of course, the ACBS community, for us to promote learning and training opportunities as well, and for us to maintain the quality of content and form with the best practices of the ACBS community. This was a collaborative effort from the chapter, ACBS chapter Southern Mexico, in which we wanted to find resources that could be useful for the Spanish-speaking community as well. So we were noticing this was a very good area for us to start, for us to find these resources and also to spread them, so that it's so that the access to different scientific approaches is more available. With this in mind, all of the members of the chapter were discussing the values for this education program that could be like the strengthening of our professional development. We're also thinking about some positioning, some like gathering this permanent learning for us to do it in a safe environment with human warmth, also like propose some things such as, well, that's the innovation part. We're also attempting to use different scientific approaches to both teaching and learning, and for us to make our own proposals, reappropriating the knowledge that has been accumulated over time. And of course, like having respect for the different methodological perspectives. With this in mind, we chose the areas proposed by the ACBS for us to continue doing this program, which could be experimental and applied behavior analysis, also contextual behavioral sciences, the relational frame theory, and contextual interventions such as ACT, the functional analytic psychotherapy, and others. We have then 4 different types of training. The conceptual one, which we propose that it would be structured with micro lessons. The attitudinal one, which is more like with experiential workshops. The procedural one, in which we will use practice groups and also like the development of projects with specific skills. And finally, the community professional interaction, which is more related to conferences, meetings, and other shared spaces with the community. This will be related to different lengths of these several workshops, courses, etc., which can be like short courses, also like medium ones, and the extended ones, which could also rely on the previous courses for you to build out these skills as well. We thought as well of innovating a little bit more with synchronical and asynchronous material, which could be like also like a database that could be useful for future generations, for them to also like hone these skills or also practice them in different ways. There are like some of the, here we can find like some of the formats that we can propose, such as the courses, technical workshops, seminars, meetings, peer groups, and there's also like the idea of Portland group, for example. So this process, we've discussed that it was like for us to, any person can present a proposal, then we will have a peer review making some observations. We have already developed like the rubric for them to have like some guidelines to do this project. And once they made the corrections to this project, then they can present to other members of the ACBS community. So we've developed this rubric for us to guide this structure in different proposals in these 4, well, in the previous 4 areas: the conceptual, the attitudinal, procedural, and also in community-based interactions. So far, what we've done is for us to call members for them to make these proposals. We've received some of them, which is very appreciated. And now we're currently in the way for us to approve some proposals and for us to start with the workshops and courses as well. This will begin in 2024. So with this in mind, we really appreciate your attention, and we invite you to be part of this collaboration. It's also like open for all the members of the ACBS, and there are like our contact emails. Thank you so much for your attention.
Okay, thank you so much. So I'm opening the floor for any question.
It can also be like questions, comments, ideas, proposals as well, like suggestions, your own courses. We can plan that as well.
Because people are just warming up right now.
That's fine, that's fine.
But so far, question for me. But so far, what do you find that's most intriguing about this project? This idea is the thing that you've done so far.
Well, what I found that is the most intriguing part is like we were all as part of the Southern Mexico chapter, all involved in this area. Like we were all like looking forward to have better education and better resources for ourselves. I think that that collaborative effort was really impressive, and we've collaborated in several stages of this part. So having like that support from others, from the members of the chapter, that was intriguing and great, to be honest. It's awesome to have that support. Also, like some of the things that we've discussed are like the skills that we need to also like work on ourselves for us to provide these resources to others, and also like for them to be up to date, right? Like with online things, with asynchronous play, and what resources we need as well for that.
And so how's the how has others been like the what's the word kind of like the intake in that how the acceptance kind of like from and with the collaboration, how has it been so far?
Well, it's been really good actually. Like we've been working on, well, the first workshops will be like how to prepare your workshops for different skills, such as the conceptual, the attitudinal, and the procedural. And it's been really great. We have a proposal currently of using mindfulness with parenting skills, which I think is great. And we'll let you know about that later on. But yeah.
And so far, which one has been getting a lot of attention so far?
So far,
is it a parenting or more on towards others that you find?
We're currently accepting proposals like that, and the ones that are in queue are like how to prepare your own procedural workshop, how to prepare an experiential workshop, and how to deliver like that conceptual knowledge as well. So those are the three following courses, and then with that we expect more proposals to arrive.
Any from outside of Mexico itself?
Well, we're all from different places. Like part of our community comes from Guatemala. There are others that come from Peru, I think. Myself, I am currently in the USA, and most of them are in Mexico, in a region that's called Oaxaca, and also in Merida, I think. So we're all over the place, yeah.
And usually where it is most being done in, like, is it more in the US, in Mexico, Guatemala? Which venue are usually most popular?
Well, I guess Mexico, yeah, for sure. But we all have like these monthly meetings online so that we can all group and discuss these ideas.
Okay, I think that 15 minutes, within that 15 minutes, thank you so much, Cesar. It's been very interesting. Okay, so it's very nice to get all this sharing from everybody here from different part of the world. Okay, so let me go to the next presenter. So let me look at the... So I can see here, Subhashini, you're here, right? Okay, so I would like to welcome Subhashini to share her topic on the effectiveness of acceptance and commitment group therapy ACTG on weight self-stigma, experiential avoidance, weight-related quality of life, and body mass index among overweight women in Malaysia. So I'm leaving the floor to you, Subhashini.
Thank you so much, Dr. Marina. Greetings, everyone. My name is Subhashini. I'm a PhD candidate in the Faculty of Education in University of Malaya, Malaysia. First of all, I really like the project because I've got two screens on, one for video, one for my PPT slides. So please forgive me for that. So today I would like to present my paper on the effectiveness of acceptance and commitment group therapy on weight self-stigma, experiential avoidance, weight-related quality of life, and body mass index among overweight women in Malaysia. So basically, a very brief view of, brief explanation of obesity. It's actually one of the global epidemics that has been steadily growing each year. Yeah. So in Southeast Asia, Malaysia has the highest prevalence of obesity among adults. And on top of that, the most of the at-risk population in Malaysia for overweight and obesity is adult women as well. Before looking into the intervention, it would be worth to investigate the risk factors of overweight, as this found to be the contributing factors to weight gain and weight relapse. Yeah. So first risk factor is weight self-stigma. Weight self-stigma is defined as the internalization of weight discrimination. Say, for an example, an individual may start accepting and believing everything, the kind of discrimination that they hear from, say, their loved ones or their peers, so they start accepting and believing in them. And high levels of weight self-stigma could potentially affect an individual's physical and mental well-being, because they may start becoming less compassionate toward themselves, or they may even start indulging in binge eating just to avoid feeling any sort of uncomfortable feelings. Yeah. Second risk factor is experiential avoidance. It is defined as the attempts to avoid thoughts, feelings, and memories that are painful or uncomfortable for someone. So basically, someone would be, in order for them to not stay not to be willingly stay in contact with their emotion, what they would do, they would tend to dive into any kind of pleasurable or happy or pleasant behavior for them, just in order for them to avoid going through such distressing emotion. And most of the time it's binge eating or isolating themselves. Let's move to intervention. There are two types of intervention for weight struggles. The first one is weight normative approach, which is the standard weight loss approach, where the focus is on calorie intake or physical activity and goal setting. And the other type of intervention is weight inclusive approach, where the entire focus is on reducing weight self-stigma, improving self-compassion, and also mental well-being. At the same time, less to zero importance is given to physical well-being. So the acceptance and commitment therapy, which was developed by Stephen Hayes, has been proven to be effective in treating weight-related struggles. So say, for example, reducing weight self-stigma and enhancing physical and mental well-being as well. So although there are very limited studies in their field, ACT has been found to be very effective in maintaining long-term benefits when it comes to weight-related issues in the Western culture. Right. So the triflex model by Russ Harris was actually used as the basis for this study. So the triflex model is the simplified version of the hexaflex models, which has, so the triflex model has 3 domains, as you can see, which are be present, open up, and do what matters. And each domain has all the core processes that you can find on hexaflex model. So extensive study, like I mentioned earlier, extensive studies have been carried out on ACT-based intervention for weight-related struggle in the Western context. As you can see from here, one of the studies found that there were decrease in, so after 10 weeks of intervention, there was a decrease in weight self-stigma and psychological inflexibility. One of the studies found that weight-related quality of life improved even after, so at the 1-year follow-up. One of the studies found that a modified and a culturally adapted ACT treatment manual actually presented with a reduction in BMI as well among Iranian women. So there have not been any studies conducted on ACT or on weight-related issue in Malaysia yet. Therefore, this would be the very first study in Malaysia, and this is the very first study in Malaysia. Now let's look at the research gaps. So first of all, there are lack of research on weight self-stigma and experiential avoidance in Malaysia. And second, long-term benefits of ACT on weight struggles are less explored in Asia in general. And finally, ACT, like I mentioned earlier, ACT for weight struggles is less explored in Malaysia. But anyhow, this is the very first study anyway. So ultimately, the objective of this study was to develop a modified and a culturally adapting ACT treatment manual and implement that treatment manual to just to look into the feasibility and effectiveness of overweight women. So the specific objectives of this present study are to examine any significant differences in the gains on weight self-stigma, weight-related quality of life, experiential avoidance, and BMI between the subject and the experimental group and control group after the intervention. And the second one is to investigate any significant differences in the gains on all the dependent variables in the experimental group only. And finally, to evaluate the feasibility of the treatment manual, so based on the participants' perspective. Let's move to the methodology. So this study was actually divided into two phases. In phase one, we actually developed a modified and a culturally adapting acceptance and commitment group therapy treatment manual for Malaysians specifically. And this manual was validated by a number of experts. And then we conducted a pilot study as well. So in phase two, the main study was conducted where the 10-week of intervention was conducted with a 3-month of follow-up. And we also received the evaluation on the feasibility of the treatment manual. So basically, the ACT treatment manual was modified and culturally adapted based on the psychotherapy adaptation modification framework. So what we did was an ACT self-help book called The Diatribe that has been previously used in similar studies was selected, and we used this framework as a guidance to modify and culturally adapt the manual. So the framework had six domains, as you can see. So we actually incorporated a number of techniques based on these 6 domains into our treatment manual. For an example, cultural perception towards obesity, psychoeducation on the nature of ACT, Malaysian-based metaphors and exercises, understanding the roles of and responsibilities between of therapists and the participants, weight-related coping mechanism, and finally psychoeducation on weight stigma. So this study used a quantitative approach, specifically a true experimental design. The intervention was conducted in a virtual setting through Zoom because the participants were spread all over Malaysia. And at the same time, it was during the pandemic period. Therefore, we were not able to conduct physical intervention. And as an experimental study, it had 2 groups. The experimental group where the participants received the treatment, and the control group where the participants were put on a waiting list. However, they were given the similar treatment after the follow-up period of 3 months. The sampling method uses purposive sampling, and the final sample size was 65. Okay, so these are the sample selection criteria where individuals who were Malaysian female adults aged 25 to 45 years old with a BMI of 23 and above and a weight self-stigma score of 36 and above were included in the study. So 3 main instruments were used in this study, which are weight self-stigma questionnaire, which measured the weight self-stigma, and impact of weight-related quality of life, which measured weight-related quality of life in public, work, sexual life, physical function, and self-esteem. And finally, acceptance and action questionnaire for weight-related difficulties, which measured the experiential avoidance. And finally, BMI was calculated using a self-measured height and weight. So after getting approval from the ethics committee from my university, interested participants were given the eligibility screening questionnaire, and we randomized them into experimental group and control group. So they went through pre-test and a 10-week of intervention for experimental group, and then post-test, and then a 3-month follow-up. And the final sample size for experimental group was 33, and for control group, it was 32. So this is the outline of the intervention. So the first 3 sessions were basically introductory, because this is a very most of the participants were not aware of this intervention. The 4th session was on self-compassion and acceptance, and the 5th session was on cognitive diffusion. The 6th one was on willingness and contact with present moment, and 7th was on values and committed action, and 8 until 10 is more of like a wrap up and mindfulness way of living. Yeah. So let's move on to the results. So let's look at the descriptive analysis of the participants' demographic characteristic. As we know, all the participants were women. So a total of 65 participants were included in the subsequent analysis with a mean BMI of 32.4. And majority of the participants were Chinese, Malaysian Chinese. At the same time, the majority of the participants fell under the age range of 31 to 35. In terms of significant differences in the gains between groups of all the dependent variables, from the graph, you can see T1 and T2. So basically, T1 to T2 is the difference of score between pre-test and post-test. T1, T3 is pre-test and follow-up test. T2, T3 is post-test and follow-up test. So what we found is that significant differences in the change of scores were found between experimental group and control group in all the dependent variables, and the changes in the scores were more prominent in the experimental group. So we believe from that ACT was effective in improving weight-related struggles, which is all the dependent variables in the subjects, of the subjects in the experimental group compared to the subjects who did not undergo the intervention. So taken together, the data analysis demonstrated that the intervention was found to be significantly more effective in improving the weight self-stigma and all the dependent variables in both short-term period and long-term period as well. So that was amazing. So in terms of significant differences in the experimental group itself, it has been found that all the dependent variables were statistically significantly different at different time points, so pre-test, post-test, and follow-up test. A post-hoc analysis revealed statistically significant differences in weight substigma and BMI scores between pre-test, post-test, and follow-up test. So this indicates that weight substigma and BMI, they improved even after the completion of the intervention. However, both experiential avoidance and weight-related quality of life, they reported statistically significant difference between pre-test and post-test, but no differences were found from post-test to follow-up test. So this concludes that the level of experiential avoidance and quality of life, they maintained after the intervention, yeah? We're almost done. So during the final stage of the intervention, the participants were given an evaluation form. So they were asked to respond to a number of statements, and the overall results of the evaluation appeared to be satisfactory. So let's get to the final part of the presentation. So first of all, like I mentioned earlier, this is the very first ACT study on weight-related struggles in Malaysia, and it has proven that a group-based virtual ACT is a promising intervention for weight-related struggles, as it benefits for a longer term as well. This is also a preliminary evidence of a modified and a culturally adapted intervention for weight struggles. So what was really amazing is that it reduced weight self-stigma and BMI. The thing is, we did not cover any physical activity or any goal setting, any weight-related component, any weight normative approach component at all. However, participants still managed to decrease their BMI, so that was really impressive. So this study also helped raising awareness on the dangers of weight substigma and experiential avoidance among participants. So I would say that this study would be a the approach would be a cost-effective approach for weight struggles in Malaysia. So the findings that were found were pretty much similar with the previous study, which is in 2018. So the limitations of this study are, so majority of the recruited participants were between the age range of 31 and 35 and Chinese. So future research could consider recruiting more Indian or Malay participants from Malaysia, as the prevalence of obesity is a tad bit higher compared to Chinese participants. It was an online intervention. Why is it a limitation? Is that because the physical connection was a tad bit lacking as well? It was also a self-measured BMI, so there might be a bit of response bias as well. So in terms of recommendation, we should recruit male population and use the intervention to see if it works for male population as well. We need longer period of follow-up to exhibit longitudinal impact. At the same time, it will be amazing to compare experimental group with an active control group and conduct mixed method to understand the efficacy of the intervention. So in conclusion, it was reported that a modified and a culturally adapted intervention reduced the rate of weight self-stigma, experiential avoidance, BMI, and it increased the quality of life compared to the control group. However, like I mentioned earlier, the scores for quality of life and experiential avoidance maintained after the intervention, whereas the scores of weight self-stigma and BMI decreased after the post-test period. So this is something that future research could look into, the causes and all. So this is the list of the selected references for this presentation. Thank you so much.
Okay, thank you, Subhashini. I'm opening question to the floor. Anybody have any question to Subhashini? Or
I
any
have a few,
comment?
I have a
Yeah.
few, but full disclosure, I did review this intervention at the early stages, so there is some biasness there. Question: how is this culturally adapted in terms of the intervention, given that you have a quite homogeneous population here, and your target is Malaysians, which has a heterogeneous culture?
Are you asking me how it is culturally adapted?
Yeah, basically, to put it differently, is that all your participants are Chinese.
Right.
It would not be usable at all in Malaysia if you talk about culturally adapted.
Right. Because when we actually adapted when we actually modified and culturally adapted the intervention, we incorporated every single, so all the three major races, so all the values of three major races, so Malay, Indian, and Chinese, all their values and beliefs, we incorporated them. But unfortunately, more Chinese participants showed interest in this. Therefore, we didn't modify it, but we had to focus more on the Chinese-based values and beliefs towards the end. So that's something that we had to modify towards the end.
I think probably that has always been a problem with any interventions in Malaysia. It has always plagued us when it comes to culture.
Right.
I think you're potentially experiencing the same thing that any of us who do research in Malaysia when it comes to culturally sensitive. My other question is that if I'm looking at your graph, it's somehow the ones who are receiving X seems to be the mean scores tends to be much worse than the ones that are in the control group. And no doubt they did decrease over the period of the studies, but
Right.
the control group seems to start out at a very nice baseline and they never change at all. But they start off well off. They started well off. Do you get what I
Right.
mean? They don't actually start at the same baseline as your intervention group.
Right.
How to explain that? Why did the control group end up scoring much better in those scores at the very beginning?
To be fair, how we looked at it is that maybe the fact, because we told them that they're going to be receiving an intervention, we told them that they're going to be receiving a mindfulness-based intervention. So we believe that maybe because these are the parties, so we actually did a bit of entry interview with them as well. So we noticed that majority of the participants were the one who actually tried losing weight for so many years, and they are at the point where they actually want to give up. So when I actually gave them they actually told them, we actually recruited them, they actually told we assumed that maybe they did a bit of research on them, maybe they're just hopeful that they're going to get the intervention, just do a bit of research, so it could have been improved because of that, maybe.
Okay, have you gone for your XYY? Personal question here.
No, I'm waiting for my
These
Viva.
are things you potentially would need to consider, especially if you have external interviewers.
Right.
Just to point out here. But
Okay.
yeah, thanks
All
for
right.
answering.
Okay. All right.
No problem.
Okay. So thank you, Subhashini. In keeping to
Thank you.
time, okay, we'll move forward to the next presenter. So I would like to invite Ainur Diloglu. Okay, all right. Okay, so then the presentation will be, is there a relationship between being democratic and having value-oriented action on parents' styling? With that, I'm inviting Ainur to the floor.
Hi. Actually, we are a group with Betu and Fatma Nur, and inshallah, Betu and me will be presenting. But hi
Okay.
to everyone.
So that's why, if it is okay for you, could you give me the host first? Because let's.
Can you give me make me the host, because I will share the presentation.
You could share even if you don't have hosts. Go ahead and share. The permission should be there.
Okay, thank you. Okay.
Okay, hello.
Can everyone see
Oh,
the
sorry.
screen?
Yeah, we can see that, I know. So, hello, good afternoon. We are from Turkey. So, I'm Betül. I'm with my friends Ainur and Fatma Nur. We are gonna do oral presentation. It's about does have a relationship between being democratic and having value-oriented actions on parent style. So first of all, I'm going to explain the background part. The purpose of the studies of value-oriented approach allows it to make sense of the many people's lives. So it helps to set off it is responsibility within the value rather than the value. So that's why the question comes on my mind is that where does the concept of the parenting stand among these responsibility? Could you move on, Ainur? So that's why in this study, we qualitatively explore, we aim to observe whether the democratic authority feature increased in the value-oriented parents. So when we look at the methods parts, first, our goal here is to include the living spaces given the sample of the research consists of the 92 parents, including a mother and the 3 fathers who live with at least 1 child. We use the 3 scale. First one is Valued Living Questionnaire, which is called also VLQ. And this scale, our purpose is we include the living spaces given by people. So we aim to understand that they are the parents' quality of life for each area. And second one is Acceptance and Action Questionnaire 2. in how does the psychologically flexible hang out in their parenting, or is psychological gender high or low? So that's why we want to use this one. And third one is the Turkish version of the parenting styles and dimensions questionnaire. In this scale, purpose of this, that's why we use it. What is the styling of the parents like, especially in the scale, they focus on the 3 point. First one is democratic, authoritarian, and the last one is the permissive. And so the Einar keep going on the other parts.
Okay. Hi again. Inshallah, I will inform you about the results and the significant parts of this abstract. Firstly, I want to say it, our results are positive. That means being a democratic parent is positively correlated with a living of valuable domains and value-oriented behaviors. And only democratic style had a positive correlation with the valuable domains and value-oriented behaviors, not the other parenting styles. And these are our results of ANOVA. Regression was found adult 003, and our dependent variable was the democratic parenting, and our independent variable was the value of domains and value-oriented behavior in general. As you see in this table, that shows that being aware of value of living and taking actions with a positive link to being democratic parents. But that means they will be, it doesn't mean like there's a certain link with the other parenting styles. Now, I want to explain briefly the other significant correlations we found in this experiment. We mainly considered democratic feeder, but we also had other hypotheses in our minds, and they have different results which we didn't expect. For example, we have a question: can a democratic parent be a permissive, a free parent at the same time? No, it's not. Being democratic and being permissive are negatively correlated. It's in this table, and being democratic doesn't mean there will be any lines and rules. And then you might have a question: being authoritarian dominant does have any correlation between valuable domains and value-oriented behavior? Results are negatively correlated. And psychological inflexibility is the positively related with the authoritarian styling. An authoritarian parent doesn't have psychological flexibility according to these results. I think it's important for the understand in ACT window for the psychological flexibility. Also, beyond the results, we had some new questions about the next experiments and next abstracts. And I want to share these ideas, these hypotheses for the others to develop a better understanding of the ACT. Our survey generally completed by mothers. There's a really rarely men. So there might be some differences on genders with the parenting styles. Also, they are generally Turkish people, Turkish parents, so there might be some differences of parenting styles according to culture, but we don't know about this with the details. While we were collecting data, we didn't ask how old were their kids. Being baby's mom or being teenager's mom have made differences. We don't know, but having some specific questions about it. So if there's any change of parenting styles according to kids' age, we don't know this too. It might help to understand better them. And we asked on our surveys, please complete this survey if you have at least one child. So does having more children have any impact on parenting skills which are linked to value-oriented actions and behaviors? Also, this came up to our minds. This is what we all have got for now. Thanks for listening to us. I hope you enjoyed. This was our first conference for an abstract. If we had some unclear points, please let me know, and we hope to be forgiven. And if you have any questions, please ask.
Okay, thank you, Ainur. Okay, so that is an interesting look into parenting style. So any question? I'm opening to the floor. Any question to the team from Turkey? Okay, I have a question actually. Prior to that, do you have any ideas what are the usual parenting style in Turkey? Because in Malaysia itself, we can see there's a shift into the parenting style, maybe because of the influence from the Western country or even from some new things that's coming in with the new era, with the digitalization and everything. So we also are seeing the shift. And from Turkey, do you see there are changes in the parenting style as well?
In general, in the culture, Turkish moms is more come up like having connections with the kids. I mean, in even their mid-20s or mid-30s, they are really strong bond. And frankly, I couldn't see any change of it, because still mothers were making this survey completed more likely. And as I remember from the answers, it still shows the bond, I think. I don't know the change part, but there's a really strong bond with the Turkish mothers with their kids. And also I was expecting like they were more likely to be authoritarian, but it also shows that I'm wrong. They are more likely to be democratic. And I see my idea is challenged with the being permissive and being democratic. They are totally different. I mean, I was more likely to think like being permissive probably will be the being democratic, but it doesn't mean like that. I mean, being authoritarian, being permissive, and being democratic are totally different areas for parenting styling. And for the results, mothers are generally with the being democratic. I wanted to share like this. Thank you.
So what is the impact of your study, do you think? What was the impact of it?
Betul, do you have any idea of it?
Actually, I'm thinking also too.
I think its impact to act develop better, because our question came up with the think of people. If people can have a more valuable life and value-oriented behaviors, they will be more happy in their lives. So what's the point to getting this higher to being happy and being more value-oriented behaviors? So we thought if parents, because the family is the little community in a country or in a community too. So we thought that if parents can be democratic and let the kids have their own valuable actions, valuable ideas, so there will be more happy people. So if we have new experiments, new abstracts about it to develop with the significant points, it can be a really huge impact on it.
And can I add something? I think it's also impact point is that the child numbers, I mean the ages. It's very important after the other researchers. I'm sure that the result might be changed a lot of, because when we look at the little one and the big one, I mean the teenager ages, it can be changed. So I think the impact point is there in here. I believe that.
Yeah, I can see the view, because me as a parent also, I have smaller kid, I have an older kid, the teenagers and the youngest. So the youngest one, I use a different style of parenting, and for the teenagers, I use a different style of parenting. So thank you very much, Team Turkey. Okay,
Thank you
so
too.
so let's go to the next presenter. Okay, back to Malaysia then. All right, so David Tan Mingui, are you here? Right. Okay. So he's going to share his presentation on gendered narratives and cultural shifts, a qualitative study on decadal changes in community. Sorry. Getting older, so problem reading. Okay, so I'm giving it to you, David.
Sorry, I have to quit and reopen to share my screen. Okay. Am I clear? Can I be heard?
Yes.
Yeah,
All
go on,
right.
David.
All right. Okay. So I'll start presenting. It's a bit lengthy here. So thank you for the introduction. So I'm going to present on a qualitative study. The title is Gendered Narratives and Cultural Shifts, a qualitative study on decadal changes in community alcohol consumption. It's actually a study that was carried out about 2 years back, but I've only managed to complete the manuscript recently. This study was actually in collaboration with an NGO. We were just trying to survey how is the alcohol situation used in Sabah. And then we have managed to gather some very interesting insights from all the focus group discussion that we have done. And so with permission, we have also came up with a manuscript of this qualitative study. We noticed that from literature review as well, that the alcohol consumption in Sabah has social cultural influence, has very special gender and demographic patterns, and also diversity in cultural practices. This is more pronounced in the eastern part of Malaysia rather than the western part of Malaysia. So what we did was we identified 4 zones in Sabah, namely KK, Kudat, Penampang, and Kiolu. And in each zone, if we manage to gather more than one group, then we will gather more than one group of focus group discussion. Otherwise, some of the zones we only have one focus group discussion. So all in all, we have 7 focus group discussion, each of them comprising of 6 to 7 members each. And then the age will be ranging from 14 to 81 years old. The interviews are conducted in BM, Bahasa Malaysia, and we have 2 prompt questions. Number 1 is, how has alcohol consumption in your community evolved over the past decade? And how do gender and culture affect the alcohol consumption in your community? So in terms of reflexivity, due to my urban-centric perspective and also my psychiatric background, I noticed that it may limit my insight into the cultural significance and accessibility of alcohol in the community. So to address these changes, I needed to maintain a reflective diaries, document and manage my potential biases, and also regular discussions with my supervisors back then. I think I'll skip the results. We transcribe all our audio. It's very lengthy. I needed help from a neutral third party. And we noticed that there were 7 themes that emerged, namely cultural significance, consumption patterns, accessibility and visibility of alcohol, peer influence, gendered expectation, family influence, and negative repercussions of alcohol use. So alcohol, cultural significance means that alcohols once entwined with celebratory traditions, which is very rich in Sabah, now seems to serve as an escape from issues instead of the past celebratory traditions. And during the COVID-19 pandemic, alcohol consumption patterns have shifted as well, with increased drinking attributed to joblessness, to boredom, and also emulation of older generations, while traditional drinks and festive seasons continue to influence consumption habits in certain areas. The community's alcohol accessibility is also increased significantly. It's easier to buy, it's easier to get alcohol, evidenced through numerous outlets, home brewing practices, and also stores that have been mushrooming over the past few years. Peer influence has fostered an environment where drinking is at times linked to displaying of strength and social drinking practices. And I believe this is also something that we may have noticed even in non-Sabah areas. But what is the most interesting finding, and hence the focus, hence the title of the qualitative analysis, is that we noticed that there is a noticeable rise in women drinking alcohol and also producing alcohol, although the societal perceptions continue to differ, emphasizing that the societal acceptance of male drinking as a show of strength, and also stigmatization of female drinkers. So this has a lot of cultural expectations behind these stigma and all these expectations. Family influence is also very interesting in Sabah, because we used to think that family may have been a deterring factor to alcohol use. But here, sometimes parents are the one who provide alcohol to their offspring and encourage instead the use of alcohol as a form of a celebrating tradition. And of course, negative repercussions of alcohol consumptions in terms of health, relationships, work, and finances. So the discussion would include alcohol consumption dynamics of change. There is also change in gender dynamics, peer influence, and last but not least, consequences and also the societal impact of alcohol use. Domestic violence seem to be a very significant issue in people who use alcohol, especially during the pandemic, because not only people have nothing much to do, like in those areas that are more secluded, they have also no way out. So women and children are especially susceptible to domestic abuse in relation to alcohol use. Conclusion is that Sabah's alcohol culture reflects a blend of tradition and also a change amid global influences. There's evolving gender roles and global events like the pandemic that shape alcohol dynamics in Sabah. So navigating this shift requires honoring tradition, at the same time addressing our more contemporary challenges through community-focused strategies. Yeah. So that's my presentation. Thank you for listening.
Okay, thank you, David. Okay, so I'm opening the floor for any question or suggestion. Okay, so Malaysia being very multicultural and different states have different kind of culture. Yeah, not to mention it's like almost like Sabah, Sarawak, and the the West Malaysia, almost as if it's still in Malaysia, but somehow have different kind of tradition and cultures. And alcohol, because so far I've from what I've heard, alcohol has been a major like a tradition in Sabah and Sarawak. And it's like if somebody actually give you alcohol, you're not supposed to reject because it's a sign of being rude. Okay, so you were saying that tradition changes more now when you were looking into your study?
Yeah. So in the past, alcohol seems to be very closely related to celebrations, to honoring traditions. But recently, people have noticed that it is not much so anymore, that it is becoming more of a coping mechanism and escape instead of celebrating tradition. Yeah.
So what do you think causes the shift?
I think urbanization is one major cause, and also the introduction, a lot of them mentioned about the introduction of non-traditional alcohol beverage. Yeah, last time when making alcohol is also supposed to be like a community work. They work together in producing alcohol and they celebrate the success of producing it. But with the more contemporary alcoholic beverages, they don't see that anymore.
So it became less of a tradition and it's more of, some became a lifestyle and some becomes more like a recreational instead of being in the tradition itself.
Right.
Okay, all right. So what do you think the impact of this study from what you come in?
I think it gives people like me, people from West Malaysia, a very good insight of how different is people's view on alcohol is. And as a mental health practitioner, when seeing patients with alcohol use problems, we may also want to address their views, the tradition behind the alcohol use, instead of just saying, no, you shouldn't drink.
Yeah, meaning still showing certain respect because of the fact that we have different culture compared to people from Sabah and Sarawak, because it's part of the culture. Because I was studying in Ireland, so it's totally like alcohol. It's just something a ritual right for them as well. So I can see that how it differs, because for us it's a blend, a lot of some tradition, some religion. So there's a mixture of that. Okay, so I would like to thank you, David, for an interesting sharing. And to all the others as well for the oral presentations. Hope so this will give you an opportunity to kind of share whatever work that you have done, and also giving you, like, especially for the team from Turkey, since it's the first time presenting, so it'll give you a first experience of ever presenting for the next conference or maybe other presentation. So with that, I'm giving back the host to the next.
Thank you. Yeah, Aisha, I'm going to make you co-host and then you can take it over. All right, Aisha, all over to you.
Okay, thank you, Eugene. So we are right on the dot at 1 p.m. and we are now up for the next session. So some housekeeping announcements before I start. Just that this event will be recorded and please leave your camera on if you think it's possible, depending on your bandwidth, definitely. Please remain muted unless you're speaking, and please raise your hands if you wish to speak during the presentation, or you can keep your questions also to the end and we will address it afterwards. Okay. So the next thing that I'd probably like